Milan, thanks for joining for this digital discussion. It's good to talk with you as always, and looking forward to just spending a few minutes discussing MyCare and you guys' use of point of care technology as part of your overall value-based care strategy as an organization. But maybe we'll just, for folks who don't know you, a couple minutes just on who you are and who MyCare is.
MyCare is a value-based care company, ultimately focused on providing the best possible medicine at the right place of service at a low cost with an exceptional patient experience. Predominantly, we cater to Medicare populations, but obviously also serve commercial members and exchange members throughout our continuum. Today, we're 44 clinics throughout Florida and in Texas, and rapidly expanding within those markets and setting our sights on other states as well.
Great, Milan. Thank you. Do you guys, I know you're growing, do you grow through acquisitions or do you go through affiliations? A little bit of both?
Yeah, a little bit of both. So kind of our four pillars of growth, if you will, is organic growth through increasing patients in our same clinics year over year. 2, acquisitions. 3, adding additional downstream providers that we feel we can support along the value-based care journey. And then obviously working with our payer partners as well to have potentially patients reassigned to us that are not being treated in the way they probably could be.
So, Milan, I imagine there's a care model that you guys have that's worked well and that you're now expanding, and there's probably a clinical component to that, and provider experience component and a patient experience component. How does technology fit in, or what do you see as really the core components of your model?
Yeah, so great question. Look, ultimately at MyCare, we like to call it the house on the hill, the 5 things that we kind of focus day in and day out. And those 5 things really are strong provider recruiting and engagement, best-in-class patient retention, acquisition, and intake, proper evaluation of medical conditions, right, from a revenue perspective, but also it drives better patient care. 4, better 24/7 quality patient care. And lastly, a superb patient experience. And the way we envision technology and how we put it in practice is analytics and technology and IT infrastructure sit below all those pillars, right? So we spent a lot of time focusing and investing the right people, process in those 5 areas, and really technology is the accelerator and the way we monitor kind of, are we truly as effective as we'd like to be in those 5 areas.
Great. And I imagine those sort of exist across, because I know you guys, you aren't on just one EHR, right? You're on, there's a core set of EHRs, and then you have all of the diversity within your kind of affiliate network and maybe even some of your own network. How does that scale across EHRs?
Yeah, so today, kind of MyCare and within our employed model, we have 5 different instances of EMR. That EMR is ECW. We're working to consolidate that into one, but obviously we're always going to have some number of instances as we acquire practices and are working through the integration. In our affiliate side of the house, we have 82 partners that are in 15 different EMRs. And so basically, from a technology standpoint, what we like to focus our time on really is setting up structured data in our owned environment, but supplement with technological tools such as Vim that actually can provide us daily visibility that's not labor intensive or is not manual in effort, right? Of determining physician engagement and determining really how effective and efficient are patient visits, whether it's from our employed model or our downstream partners.
That's helpful. And you guys have been doing this for some time. You're not new entrants into this world. What are some lessons you've learned about technology solutions, maybe especially ones that are provider used? What have you learned about tech for provider enablement?
Yeah, I'd say a few things we've learned is um, one of the challenges is, look, everyone says they can integrate with the EMR, but are they actually integrating in practice, or are they planning to go through a 6 to 12 month labor intensive, both on the vendor side and on the operating side, to get it completed? Part one. And two, how scalable is that as your business model changes? And so as we think through technology, that's one key thing that we always ask is specific questions of, are you really integrated? Are you integrated today, right? And what is the process of integration? Because that's key for us.
Milan, how does physician experience factor into that? I imagine with these technology tools that are physician facing, we know the track record on tech for docs, EHRs or other things hasn't always lived up to expectations, but how do you guys manage the physician experience side of this?
Yeah, I mean, ultimately, the physicians are at the center of this, right? They're using the tool. Our jobs are to support the physician so they could drive better patient care, right? And so that's only going to be as effective as how much physicians are involved and bought in, right? When you're deploying technological tools. And so what I would say for us, the key is, when we're evaluating relationships, it's really, our physicians are heavily involved, our physician leaders, right? And so it's flexibility within the MyCare model, with whatever tech solutions that work with our workflows and our nuances, into scalability and speed to action to make those changes. As you know, you can project plan tech solutions up the wazoo on the front end, but really when it goes to the end user and multiple end users, and there's the varied kind of different workflows, right? That's really where you identify where things may have been missed.
Yeah.
And the other very important thing is, when you talk about with physicians and technological tools, is what is the data, right? With physicians, especially when they're in that exam room and they're in their office, if they don't understand what's presented to them, right, whether it's in the EMR or separate system at a point of care, they're going to ignore it, right? And so the physician involvement on actually the data component is also very key as well.
So, Milan, one of the things we've always been impressed with MyCare is how you engage your clinicians as a partner in technology solutions that you're deploying, both in how you're putting extra context in front of them in terms of the data they're being asked to review, the gaps they're being asked to address, and things like that, but also in how you get their clinical feedback, their user input on the solutions themselves, and how you kind of gather buy-in that way that I think leads to really high adoption. If you were giving advice to maybe an organization like you guys who's a year or two earlier in that journey of deploying technology for physician enablement, what advice would you give them?
Yeah, look, ultimately what I would say is it really depends on kind of what data and processes you've already created to date, right? So as you're looking for a technology vendor, if you don't have that data and those processes, that's okay, right? That's just part of the steps of moving along value-based care. But then you do need to rely more on your technology partner, right, to ingest that data, to normalize that data, depending on the number of payers you have, to put it all together, right? So it's seamless no matter what kind of patient, what insurer, Medicare, Medicaid, exchange, doesn't matter, right? How you actually care for the member and present information to your providers is the same.
Milan, thanks so much for the insights there, even just in brief form. I think it's super helpful experience to hear from an organization that's really done it in terms of deploying technology to move value-based care forward on the ground in partnership with your clinicians. So thanks for your time. Really appreciate it.